Lungs, let and limit cardiopulmonary insight for sport physios. As title demonstrate that the physiology is very related to the sport physio. The lungs relax and limit cardiopulmonary insight for physio. And this presentation explores the critical link between the cardiopulmonary and the musculoskeletal system. We will discuss enhancing the rehabilitation, improving endurance and performance. Our approach is basically the evidence-based with the practical application of it. Not only the evidence, we should apply on the practical manner. Okay, first of all, understand the cardiopulmonary foundation. What it is, it's a respiratory physiology, it's a cardiovascular physiology. As we discussed in the respiratory physiology, we basically discussed the most important thing is the ventilation, diffusion, and perfusion. And about the cardiovascular, the most important thing is the cardiac output and blood pressure. And during the exercise, when the demand is increased, required efficient delivery. An elite marathoner can increase ventilation by 20 to 25 times. This is very important to understand. The elite marathoner can increase ventilation by 20 to 25. Okay, what are the learning objectives in this slide? Are the understand the physiology, learn the basic cardiopulmonary function. During exercise, recognizing the limitations, identify sign of cardiopulmonary issue in athletes, apply strategies, use evidence-based method to improve function. First of all, we discussed the basic cardiopulmonary physiology. We should know about the cardiac output, that is Q, and the cardiac output is the stroke volume into heart rate and major blood pump per minute. VO2 max, the gold standard of the cardiopulmonary physiology and respiratory physiology. This is basically the maximum oxygen consumption and expressed in milliliter per kilogram per minute. As we discussed about the fifth equation and what it's important regarding the cardiopulmonary physiology, basically what do you mean by the VO2 max? And the VO2 max basically the cardiac output and the difference between the arteriovenous concentration. And it relates oxygen due to blood flow. Now we come to the minute ventilation. It's basically the tidal volume and into the respiratory rate, air breathed per minute. Basically, before starting the complex manner, we should understand the simpler one we understand. Defining cardiopulmonary fitness. Yes, Ushna, anything else? Yes. Sorry, Ushna. Anything else?
Yes, it is now.
Can I continue?
Yes, sure, ma'am.
Okay. Okay, cardiopulmonary fitness, basically the efficiency of your heart and lungs during exercise. This is the fitness. Before we discuss the cardiopulmonary physiology, and now we discuss the fitness. Basically, this is the efficiency of your heart and lungs during exercise. The key indicator include the VO2 max. And VO2 max, again, we said the maximal oxygen consumption. It measures in milliliter of oxygen used per kg of the body weight per minute. Okay, what is the average level? We should know about the average level of VO2 max, and this is the 35, between the 35 to 40 milliliter per kg per minute for men and 27 to 31 milliliter per kg per minute for women. But in elite athletes, it would be increases up to 80 milliliter per kilogram per minute. And in women, it increases up to 70 milliliter per kilogram per minute. As we discussed in last slide, uh, whenever the exercise starts, the ventilation of athletes is increasing 2 to 3 times. the limitation. There are some signs which occur. For example, the sign of a cardiopulmonary limitation, first of all, performance drop. These are the limitations which show the cardiopulmonary system is not working properly. The performance drop, exercise intolerance, fatigue, dyspnea are the red flags. They indicate system strain. Now, and the heart rate recovery, basically the abnormal heart rate recovery is crucial. A drop of less than 12 beat per minute is considered. As you, if in this section, I think all other physical therapists, they all know about the Harvard test. Basically, we use this test to considering about to evaluate the recovery rate of your heart. And if the recovery rate is less than beat per minute, this means it is concerned. And the warning signs are the chest pain, dizziness, and the excessive breathlessness. Need attention. These signals are the potential issue because whenever dyspnea occurs, it means you can never do the exercise more. As you know, the RTE, we use this scale rate of perceived exertion to know about the evaluation of discipline, to know about the breathlessness of discipline. It's a screening tool to know about the discipline. Okay, another screening tools are the CTEC and spirometry and ECG, aid diagnosis. They identify underlying problems. Okay, cardiopulmonary assessment in sport physio. Why cardiopulmonary evaluation is matter? Why it is matter? Because there is a hidden bottleneck. Undiagnosed respiratory limitation hinder athletic performance and athletic potential. Fatigue of respiratory muscle causes exercise intolerance. Definitely, performance boost, integrated assessment uncovers hidden performance. That would be the bottleneck. And elite cyclists improve VO2 max by 15% after targeted inspiratory muscle training. That would be in evidence in McNair et al. In 2011 that it matters that an elite cyclist improve, it means the aerobic exercise improve VO2 max by 15%, and it is evident by McNair et al. In 2011. Practical screening tool for physio, streamlining assessment in the clinical setting, identify athletes at the risk of cardiopulmonary limitation. Basically, the elite central approach to help tailor intervention effectively. They focus on a individual need. Uh, the tailored program is very important. It's focused between the athlete center approach and the early detection. Catching issue early prevent complications. It also optimizes training plan. Okay, quick easy screening method, regimen questionnaire, which identify the dysfunctional breathing pattern, as we discussed. Another the regimen questionnaire, we have a rate of perceived exertion that is called the RTE, and the self-efficacy scale for managing chronic diseases, and the clinical COPD 2 questionnaire assess and track the respiratory symptoms. A score greater than 1 indicates a significant impact, and that would be evident Vander Morning et al. 2000. The score and the symptom, if the score is greater than 1, indicate a significant impact. Okay, advanced screening tool included the auscultation. These are the important rulings to identify every type of disease like MSK, cardiopulmonary, uh, and so on.
And ma'am, we have two questions in our chat box.
Okay.
I'm sharing this.
How do you modify your treatment plan to address both acute and cardiopulmonary concern in patients with a complex presentation? Yes. When managing patients with a complex presentation involving both MSA, as I discussed in the case study, which have both problems, his ACL, after his ACL injury, he have deconditioning in the muscular rehab, and also in this condition, he also faces the uh, cardiopulmonary issue. So, first of all, we should plan, we should individualize and multidisciplinary plan. First of all, we understand the MSK rule, right? What are the assessment, what is posture, what is norm, what is strength, what is pain, what is functional impairment. And then we come to the cardiopulmonary assessment. Because after any surgical intervention or after any surgery, the patient faces many complex mechanisms regarding their cardiopulmonary issue. But more important is pulmonary issue. It's a uh, secretion issue. So first we rule out the pulmonary issue, then we come to the MSK assessment, then we come to the CT. And when we assess the CT, we should include all the monitoring like the heart rate, respiratory rate, blood pressure, SpO2, dyspnea. These all are the assessments. And we assess properly, then we diagnose and treat properly. Understand my phenomena?